So KFF.org, I'm not sure what it stands for. I hate when people use acronyms and then they don't fucking tell you what it stands for. But KFF has an ongoing research paper into Medicaid enrollment and unwinding tracker, which I don't know why they called it that. But
let me know when you're ready for me to just have a 30 seconds of screaming about the term unwinding.
Go ahead.
What the fuck is the term unwinding? No, it's the dumbest euphemism. It's designed to it's so that they don't have to say kicking you the fuck off of medical care. That's what that should say. This is the kicking you the fuck off of medical care in one of the richest countries in the world. And clearly you don't have a lot of money because you're on Medicaid. So this is kicking poor people the fuck off of Medicaid and medical care. And it's called unwinding. This would be like if you booted someone out onto the street and you said you were unwinding them. Okay.
Thank you. I agree. So they have thank you, Kaiser Family Foundation, which sounds dark. But anyway, so this is actually a very good tracker. So whatever you want to call yourselves, KFF, that's fine. So these numbers are current as of August 17th. So this is the 18th when we're filming this, so that's yesterday. According to their numbers, at least 4,816,000 Medicaid enrollees have been disenrolled. That's better than unwinding. Have been unwound.
Disenrolled still. I think it should be thrown out on their asses in the richest country in the world.
Based on the most current data from 44 states and the District of Columbia. So that's a fuck ton of people. And this happened
4.8 million.
This has happened because Biden officially ended the COVID emergency, which opened the door then for states to shove people off of Medicaid. And there is wow, there's a wide variation in disenrollment rates across reporting states, ranging from 72% in Texas.
I know, Texas is crazy. It's insanity.
To 8% in Wyoming. Maybe because there's hardly fucking anybody in Wyoming. But
anyway,
anyway,
look at this chart.
I know.
There's Texas on this side. It's insanity.
So, there's that publicly available unwinding
big
data.
Surprise. The first two are Texas and Florida.
I know.
You want to know where they care least about human beings? Texas and Florida.
So this is also interesting. 75% of all people disenrolled had their coverage terminated for procedural reasons. Now, what does that mean? Well, if you've ever applied for Medicaid, which I have, and I don't recommend it, it's not fun. It's a fucking process, and they don't make it easy because they don't want to make it easy because they want you to die. And so the procedure in terms of getting Medicaid again or reapplying, which you had to do with the end of the COVID emergency or whatever.
All kinds of complicated paperwork and dates, and
people don't know that they need to do it. I mean, one of the things that we did in mutual aid was try to get information out to people. Also, there's a language barrier for a lot of people. Not just Spanish, like Amharic. There in Ethiopian community is Tagalog in Filipino community. So it's like there's a lot of language barriers, and they don't fucking translate this bullshit. They'll send you a little postcard, but it's all in English. And even when it is in English, you're like, I got to do what? And the what? And you have to have internet access, which not everybody does. So there's all these barriers to being able to reapply. And then they'll say, the postcard or whatever will be dated 2 weeks ago. And then it'll say, you have until fucking 3 days ago to reapply. And if you don't, then you're kicked off. And it's like, well, I just fucking got this thing.
Yep.
And this is, or if they don't send you that little dumbass postcard, then, they might try calling. But what if they have an outdated number? Or what if you weren't answering your phone because you're like, I don't recognize that number and they didn't leave a message? There's just so much bullshit that keeps people from being able to access Medicaid when, of course, people should just have health care across the board. It shouldn't fucking matter.
They could strategically word things confusingly so you get the paperwork wrong. You give me 12 pages of paperwork and I'm gonna get my middle name wrong. Like it's just, I'm not a paperwork guy.
Well,
And
right.
so it's easy to fuck these things up. And they're not, this system is not meant to be filled with people going, oh, actually that you need to put something else in that space. Instead, they go, okay, you're off Medicaid now.
Yeah. And this, I mean, they're making this point that a lot of the people that are being disenrolled are people who are still technically eligible for Medicaid, because guess what? Medicaid is based on income, and it's not like people made a lot of money after the pandemic officially ended. So people are still eligible, but they're getting kicked off because of these procedural barriers.
And this is under a Democratic administration.
Yeah.
Do I have that right? Is there a Democrat in office? Because they're the ones that care and want to give us health care, correct?
That's what they said. I read it on a pamphlet.
Yeah.
They sent out a postcard
Sorry.
when we got kicked off of Medicaid. They also sent out a postcard that said, "We love you and you should have health care." So I thought that was nice.
That's nice. That's nice of them.
Yeah.
The cover of the booklet of how you've been kicked off and you know, what kind of balm to put on your ass as you land on the street. Also said on the front, "We love you and you should have health care."
But the balm is not covered by healthcare, so you have to pay out of pocket for
Nope,
that. It's
out of pocket
expensive
for the balm.
To further fuckify this whole thing, children account for 1/3 or 33% of Medicaid disenrollments. In the 14 states reported age breakdown. So it's probably more because there are only 14 states that show the age of people who have been kicked off. Because a lot of people, spoiler alert, people listening might already know this. A lot of poor people also have dependents, and a lot of we covered just 1 week ago, 2 weeks ago, how 11 million children are officially living under poverty in the United States, which is obviously higher than that because the poverty line is some bullshit. So how many kids now don't have access to healthcare because of these disenrollments, and kids with chronic illnesses, kids with, whatever. It's fucking heinous.
Build back heinous. That's what Biden said.
Yes. So
4.8 million have been kicked off so far, and a third of those at least are children. And this is the party that says they want to give you health care.
Yeah. And there's a lot of blue states. I think a lot of people are like, oh, Texas and Florida, of course. But this article in Politico also points out that there's a shit ton of so-called blue states that are kicking a lot of people off of Medicaid.
Even neoliberal outlet Politico has admitted it.
Yeah, I'm sorry. It's just that they had the article. I fucking hate Politico, but...
No, I know, but sometimes it's good to be like, hey, look, even the neoliberal bullshit outlets are noticing to some degree that millions are kicked off healthcare.
So, yeah. So this is across the board. It doesn't matter what side of the aisle your state is on. You are just as likely to get kicked off. Maybe slower. Maybe the blue state will kick you off slower, but they're kicking people off of Medicaid as well.
And actually, this Politico article, because I was trying to figure out what they meant by Biden administration warns states as millions lose Medicaid. It's because this is a neoliberal outlet. They were trying to make Biden look good. And basically, it's the Biden administration warning the states that they're kicking people off against the ways they should, or whatever. Like they're kicking too many people off of Medicaid, and they're not really allowed to do that. So you've got a guy who's just decided that they're going to go through with this, kicking everyone off of Medicaid. He easily could have kept everyone on it. And this article is like, but poor Biden is telling the states not to do that.
But then they also say, it also says in the article that there's a call center where people can call to try and reapply and shit. It says that states are in this particular case, Rhode Island is working with federal officials to build additional capacity at the call center. But the state has reduced its application processing times in order to meet federal guidelines as of August 1st. Reduced its application process,
giving them less time to actually go through the process,
right?
In order to meet federal guidelines. So they're being rushed to do this shit.
And so, again, like, the federal government is not on your side. They don't fucking. It's not Biden being like, oh, again, like, I wish I could do something about it. I wish I could help.
He's like, if I meet the guy who has control over any of this stuff, I am gonna put a word in. I am going to tell him that this is inappropriate, okay? That this country should have health care for all. If I meet that guy, and listen, this is a direct quote, all this from Biden. And listen, I have been working my way up the ladder for 70 some years, and one day I'm going to get there and I'm going to tell him, no, not on my watch, good sir. That's all a direct quote from Biden.
Oh, good.
Yeah, if he meets that guy who has control over any of this, he's going to do something.
So this article also says that there were letters sent out to the states, which I don't even understand what that means, but
I don't know what a letter is. What year is this?
That the CMS, the federal agency, the Centers for Medicare and Medicaid Services, was concerned at the rapid rate of disenrollment. Now, this is some bullshit. And I know that Politico wants you to think that, like, see, the Democrats are concerned.
They're concerned.
This is classic Democrat bullshit.
Do they have a lot of concern.
They send letters.
They are
First of all,
concerned.
When you send a letter to the state, who do you send it to? Do you send it to the governor? Do you send it to, like, the healthcare agency of that state?
It's actually the comptroller that opens those letters. She's sitting there with a little letter opener.
You know what I think? I think that shit gets sent to, like, some fucking 7-Eleven in Topeka, Kansas, and ends up being used as toilet paper. That's what I fucking
think. Due to
think.
cutbacks, the 7-Eleven clerk is also the comptroller. So,
but, like, what the fuck? You sent a letter saying that you're concerned? That would be like if somebody asked you to stage an intervention and you're like, I sent a letter to my friends saying that their heroin use is concerning. Good. That'll do a lot. Thanks.
I sent a postcard with a poop emoji on the back, and I think that should probably clear it up.
So,
So Biden's done all he can do. The Biden administration, and I always try to make it clear, when I say Biden does something, I don't mean Biden's doing anything. Like, fucking that guy, they just have him in a room, just sitting on a chamber pot. But so when I say Biden does, I mean his administration, these sociopaths that he's surrounded by. He also is one, but he's not. It's interesting. He's actually less of a sociopath now because he doesn't have the mental acuity to be a sociopath. Because he just sits and watches TV. But it's mainly Wheel of Fortune. But they show him 1975.
Wheel of Fortune still.
It is still a thing. But they show him 1975 episodes of Wheel of Fortune because he thinks those are the current ones.
They're probably better.
I think Pat Sajak wasn't that the guy, just left or was just fired or whatever. And he's like, first of all, he's far right wing and he's like furious. And so he's been yelling about how angry he is that he's not. I don't know.
Anyway. But yeah, so this is just throwing in some media literacy here. This is classic. This is a classic case of, like, the Politico trying to make them sound good by, like, well, they sent letters and the CMS is concerned. This is the type of shit that you should be looking for in all media outlets that are clearly, skewed one way or the other.
Yeah.
Concerned, or they sent a letter, or whatever the fuck. It's like, okay, but what did you do? I mean, he
kicked 4.8 million off of Medicaid. That's what he did. That's what they did.
Thank you.
Could you imagine if I don't know, if I had control over something, if I was the CEO of an organization and I fired all the workers without any kind of advance warning or anything, and then I also sent them a letter that said, very concerned about this.
Concerned.
It's very upsetting.